Hello and welcome to this recorded webinar for the employee benefits offering for Oberon Fuels. We are going to talk about benefits that are effective May 1st, 2021 and will go all the way to April 30th, 2022. The information in this webinar is good all the way through April 30th of 2022. My name is Bill Hammond. I am honored to be your insurance broker. My contact information is on the screen there. Feel free to reach out to me now as you're making decisions or anytime throughout the year if you've got questions or issues. Tamara Pintado is my senior account manager that is on the case for you guys, and she's really great for administrative stuff. Can't find an ID number, can't need a new ID card, looking for doctors, just general administrative kind of health insurance things, phone numbers you might need to call the insurance companies. So we're here to help. This will also be the last slide of the presentation, so we'll come back to it. Very quick agenda. We'll talk about what open enrollment is, the dates, benefits plans, how do I enroll, and questions and answers, of course, are going to be, since this is recorded, you can reach out to us anytime with those. So just a quick highlight on open enrollment. This is your time to make the decisions on what you want to do for the next year. If you did not enroll last year but wish to enroll now, this is your time. If you chose not to enroll a spouse or a child last year but now you want to, this is your time to do that. If you are on an HMO plan but want a PPO plan, or PPO wanting an HMO plan, this is your time. So this is the time to make any of these changes. Open enrollment is a free shot at whatever you want to do, upgrading your benefits, downgrading your benefits. Just remember that once you make these decisions, you are going to be locked in for the plan year, which goes through April 30th, 2022. For this open enrollment, we're asking you guys to get this done inside a week by Monday, April 12th. If you have questions, if there are extenuating circumstances, please reach out to your company. You can reach out to me and we can help you do this, okay? You're going to complete your applications online at the Ease Enrollment portal. Most of you are already familiar. We'll do a quick run through of that. And then finally, a reminder that if you choose to decline this offering, which it's mandatory for everybody to either enroll or decline, whichever is best for you and your family, if you choose to decline this coverage and you do not have other coverage, you have to wait until this time next year to enroll. But what's very important to understand is if you are declining this coverage for yourself, for your spouse, for any of your children, because they have other health insurance coverage, if they were to lose that coverage in the year, you would be able to join in the middle of the plan year. So for an example, if I'm enrolled in this plan, it's just me and my wife and kids have a great health plan through the school district. And then this summer, she loses that job and now she needs to come onto my plan. That would be, we'll say that she lost that job on July 15th, that her insurance would go through the end of July. That would be a qualifying event for my wife and children to join me on my plan as of August 1st, no break in coverage. Okay. So really, if you deny this offer and you don't have any other insurance, you have to wait. If you're denying this because you have coverage elsewhere and you lose that coverage involuntarily, that is a qualifying event to join our plan in the middle of the year. Okay. We have 11 medical plans available, so we have lots and lots of options. I want to really point out something important. For those of you listening to this webinar that reside outside of the state of California, you are going to be given the option to enroll in PPO plans. That's going to be the plans you can enroll in. If you are out of state, I want the out-of-state people to enroll in either the Silver PPO-C or the Gold PPO-E. These have the national Blue Cross Blue Shield network. The other plans we have are really competitive in California, but when you get outside of California, you don't have access to all the same providers. Okay. United Healthcare, HMO, this is really our Imperial Valley folks. This is where we have most of our providers. And then for people in California, we have Kaiser. And then for people in the San Diego area, we have a couple of Sharp Health plans. So lots and lots of options. We're going to kind of go through them in the order we just laid them out there. Here's our Silver plans. So notice our Silver A is the Advantage plan, and our Silver C is the Prudent Buyer plan. This Prudent Buyer network is the national Blue Cross network that you want to buy. All right. You'll notice that the plans are pretty similar. I've highlighted kind of where each of them are better than the other, if there's a difference. So for California residents, this Advantage plan would probably be the better plan for you. Just a quick rundown of benefits and what they mean. I won't do this for every plan, but I do want to do it. We'll just pick this silver plan here so we make sure you guys understand what deductibles and out-of-pockets and co-pays and all that is. So we'll start with the deductibles. Deductible is generally the amount that the insurance company says you have to meet in full before they start paying out their benefits. Okay, so with the silver PPOA plan, I've got to meet the first $1,600 out of my pocket before Blue Cross starts to spend any money. All right, then you have your out-of-pocket max, which is $8,500. This is the point at which I pay zero. So up to $1,600, I pay everything. Between $1,600 and $8,500 as an individual, we share the cost. And at $8,500, the insurance company pays 100%. All right. These numbers here on the bottom for family. This is if you have more than one person enrolled in the family. An important note about that, this word embedded right here means that even if you are enrolled for a family, no one person has to meet any more than their individual $1,600 deductible. Okay. So quick example, if I'm on this plan with my wife and 2 kids and I get in a car accident and I'm in the hospital for a month and I have $1 million in claims, I'm going to pay 100% of the cost for the first $1,600. Then here's the hospital stay. So I'll pay 40% of the cost. Blue Cross will pay 60% of the cost until I spend $8,500, at which point I am done. Blue Cross pays for everything: doctor visits, prescription drugs, hospital stays, surgery, emergency room, everything. This out-of-pocket maximum is truly the ceiling. Once you hit your head on this ceiling of $8,500 or $8,150 here, the insurance company pays for everything else for all covered services, in-network providers for the rest of the calendar year. All right. All right. So back to deductible, $1,600. Remember I said you got to pay for everything, right? There are some benefits, and you'll see it with the term DED waived. This means deductible waived. So for an office visit, I'm going to pay $45 for a regular doctor visit. I'll pay $90 for a specialist, deductible waived. So this $1,600 deductible doesn't even come into play at all. I go see a regular doctor, I spend $45. That number is accumulating towards your maximum. So now instead of $8,500 left, I now have $8,455 left. If I need to see a specialist, it's $90. If I need blood work or x-ray, it's $15 deductible waived. All right. MRIs, CAT scans, PET scans, 40% after deductible. So if getting MRIs is an important thing for you, please note that on these silver plans, most of them you're going to have to pay your whole deductible, and then you pay 40%. Blue Cross pays 60%. Here we have another deductible waived benefit. This is for physical therapy, occupational therapy, speech therapy, $45 copay, chiropractic. For in-network providers, you'll pay 50% of it on waived. You get that 20 times a year. Pharmacy deductible is interesting. Tiers 2 through 4. So not on this first level 1 tier, which are usually generic drugs. If you need a tier 2, 3, or 4, tier 4 is not on here, but it's self-injectable type drugs, you're going to pay 100% of the cost for the first $300 as an individual. Here's our family deductible. Again, no one person has to pay any more than the $300. So if I need a tier 2, 3, or 4 drug, before I get to pay $60 as a copay or $100 as a copay, I have to pay the first $300 in full, and then I get those copays. For your tier 1 drugs, you just pay $20 or $25 up front. Now, this level 1 and level 2 business is confusing. I get it. This is not what you'll see in most of the plan offerings, but with Blue Cross, they have preferred pharmacies and they have non-preferred pharmacies. They have level 1 pharmacies, aka preferred, level 2 pharmacies, aka non-preferred. So at the non-preferred providers, you'll pay a little bit more. Now, how do you make sure you go to level 1? That is where you will flip your card over, call member services, and say, hey, where are the level 1 pharmacies in my area? Down here at the bottom, we've got our hospital facility services. Again, tier 1, tier 2, same exact principle. Tier 1 hospitals, they have better contracts with. Tier 2 are a little bit more expensive providers. The only difference here is you'll pay a $500 copay, I guess you could call it, plus 40%. All right. Whereas the Tier 1 hospitals, you don't have that extra $500. All right. Keep in mind, every dollar we're talking about is accumulating towards this $8,500. So that $1 million problem I had, let's say there's hospital stays and surgeries and prescription drugs and there's all kinds of MRIs and CAT scans. Once I've spent $8,500, everything on this list turns to zero. Okay. So that's kind of a breakdown of how these plans work here. I'm not going to do that for everyone because it would be exhausting for you guys to listen to, I'm sure. So we'll move along. We've got the gold PPO plans. Now there's 3 PPO plans. On the far right, for you out-of-state folks, we have our gold PPO-E. This is the one you want, okay? Again, I've highlighted some of these benefits where some of them are a little better than others. Notice what we just talked about in terms of deductible. These gold plans are always going to have a little bit lower deductible. These gold plans are going to have a little bit lower out-of-pocket maximum, so that's your maximum risk. And the doctor visits are a little bit lower cost, all right? You still see the deductible waived terminology here. This means you don't have to pay that $1,000 or $500 deductible. But when you buy a gold plan, the deductible is far lower. So you're into these copays and into these co-insurance percentages pretty quickly. Speaking of co-insurance percentages, that's kind of what this, when you see percentages, the term co-insurance means you pay some, we pay some. So in this situation, if you need an MRI, after you met your $1,000 deductible, you would only pay 25% of the cost. Blue Cross pays 75%. Notice some of these plans still have the Tier 1 and 2 hospitals. All of them have the multi-tier prescription drug plans. That's all your Blue Cross PPOs are going to have that. So really, gold PPO plans versus silver PPO plans. If you just need a couple of doctor visits and maybe some prescription drugs and you don't have a lot of medical needs, don't have a lot of predictable medical expenses coming up, these silver plans are going to be all you need. For those of you that have a lot of healthcare needs, use your health plan quite frequently, want to get prescription drugs at a lower price, don't want the high deductible, these gold plans are perfect for you. Okay, so that's our 2 PPO plans. Then we get into our HMO plans. The 2 United Healthcare plans use the Signature Value Network. So when you're searching providers, you're looking for the Signature Value Network. All right. That's going to be your largest network with HMO plans on our offering here. And you see a silver and a gold. Notice how the silver plan is going to have a higher deductible, higher out-of-pocket maximum, more expensive copays, again, deductible waived. I really like this silver plan, and the reason why I like it so much is because you get doctor visits, deductible waived. Lab work and x-ray, deductible waived. CAT scan, PET scan, MRI, deductible waived. Therapy visits, deductible waived. Chiro, deductible waived. Okay. Urgent care, deductible waived. So it's a really good plan for those of you who have no expectation of visiting a hospital for anything, but want to make sure that you've got good coverage in case you get strep throat, you fall down, go boom, whatever it may be. The silver plan is a really good value. The gold plan, again, it's going to be a little bit better in all the ways. You can see all the copays all the way down are a little bit better. The out-of-pocket maximum is a little bit better. So the gold plan is going to be a little bit better, but the same exact doctors are in both networks. For our San Diego folks, we've got 2 Sharp Health plans, silver and gold. Again, you're going to find a lot of the same characteristics. There's a deductible on the silver plan. There's no deductible on the gold plan. Out-of-pocket max is $2,050 higher for an individual with the silver than the gold. Copays are pretty close. No prescription drug deductible on this gold plan. Lower copays for the brand name drugs. A fixed dollar copay to see a to have an inpatient hospital stay versus a percentage. Okay, so the gold plan is going to be a much better option with Sharp for your San Diego folks. And then all over California, we've got 2 Kaiser plans. This has not been real popular with our group as of yet, but it is available to you. And again, you'll see the silver plans have higher deductibles and out-of-pocket maximums than the gold do. And real importantly, you'll see this gold plan has a $600 copay per day after the deductible, which is only $250 for 5 days max. This means if you're in the hospital for 10 days, you'll pay for $600 day 1, 2, 3, 4, 5, so $3,000. And then on day 6 and beyond, you will not be asked to pay any more copay for that hospital stay. If you leave, you check out, and a month later you're back in, you have that same $600 a day copay. But remember, all of these numbers are rolling towards the out-of-pocket maximum. Okay, so no matter how expensive your year is, for in-network providers, covered services in a calendar year, the most you're going to pay is this max number here. All right. Another interesting thing to note, if chiropractic is important to you and you like Kaiser, note the silver plan has chiro, the gold plan does not. Kind of curious that the more expensive plan has not as many benefits, but that is the way it goes with Kaiser. So that's our medical plans. Let's talk a little about dental and vision. These are staying the same as we've had before. We've got Delta Dental for our dental, and we've got VSP for our vision. We've got our 2 HMO dental plans. For those of you in California, you have access to these plans. Outside of California, you will choose from the PPO plans. And here you use the Delta Care USA network. It is as good of an HMO network as you'll find, but please understand HMO dental plans have smaller networks than PPO plans. If you're someone that just wants a couple of free cleanings and you just want somebody nearby your home or office that's accredited and can take care of you in a good way, HMO dental plans are a great option for you. There's no annual maximum, there's no deductible, and there's copays across the board for everything. Okay. Also, orthodontia, if you want orthodontia coverage for a child or an adult, you have to buy the HMO dental plans. And these numbers are a copay. So a 24-month treatment for a child is $1,700. Adults are $19. Here's our Delta PPO plans. One thing I want to note here is with PPO dental plans, with these PPO plans, the Platinum plan is in the Premier network. The Gold plan is in their regular PPO network, okay, which is very robust. The Premier network is going to be one of the larger PPO networks you'll find in the nation. So very, very good selection of dentists. If a very high-end provider is who you're searching for and who you want to see, you're going to want to lean towards the Platinum plan because it's most likely they'll be in the network. Another thing to note with PPO dental plans, there's a calendar year max. All right. This is the opposite of what we talked about with medical. With medical, we said once you get to the maximum, you pay nothing else. The insurance company pays everything else. With dental, it's the exact opposite. With dental, once Delta has paid out in benefits in a calendar year, $1,500 for the Gold plan and $2,000 for the Platinum plan, they don't pay anything more and you pay everything else. All right. So that's very important to note. Again, last thing with PPO plans is there's percentages you see here versus copays we saw with HMO dental. This is because everything with PPO plans really falls into 3 categories: preventive, basic, and major. All right. Now, preventative is your exams, your x-rays, the cleaning, that kind of stuff twice a year. Basic, you're getting into cavities, you're getting into periodontics, which is kind of the deep cleaning. You're getting into endodontics, which is a root canal. That's basic, meaning you'll pay 20%, they pay 80%. Major, you're getting into things like crowns and oral surgery and stuff like that. And at that point, it's a 50-50 split. And again, once you hit the maximum benefit of $1,500 or $2,000, they pay nothing else and you pay everything else. So one way you can use this to your advantage, if you're signing up on a dental plan right now for the first time, please understand that you get this calendar year max all over again on January 1st. So say you need a bunch of work done, you could take the dental plan effective May 1st. You could use all $1,500 or $2,000 of the benefits. And on January 1st of 2022, you wake up, you got another $1,500 or $2,000, and you can spend all of that. And next April, when we're looking at our plans, you ditch the dental completely and you save the money. So you can actually kind of straddle the calendar year and get 2 of these maximum benefits. So that's important to note and a good way to kind of take advantage of the way the system is set up. And one of the few ways it's to your advantage. All right, so vision, we've got a voluntary vision plan. Both these plans are almost identical. The biggest place they're not identical is down here. I got it circled and arrowed, okay? These numbers down here indicate how frequently you get a particular benefit. So we'll start with eye exam. with the gold and the platinum plan, you get the $10 copay for your exam once every 12 months. Same. With the lenses copay of $25, $25 copay with both the gold and the platinum, you get that every 12 months. Same. The last number is how frequently you get this $180 allowance for frames or the $150 allowance for contacts. With the gold plan, you get that once every 2 years. With the platinum, you get it once a year. All right. Now, for an individual, the difference in price for an entire year for the platinum plan is about $24 a year. So please buy the platinum plan if you're going to buy vision, because you can pay $24 more per year pre-tax in order to get $180 every year rather than $100 every 2 years. So that's a no-brainer. If you're getting frames, if you're using your vision plan, buy the platinum plan. The value is so much better. It's $2 more a month, but you get way more benefits. So hopefully that was clear. If not, again, I'm available to help go through any of this with you guys individually. Now, the enrollment site is called Ease. Those of you who have been with us a little bit are familiar with this. It is still a relatively new tool we've been using, so it is a place for you to go to enroll in mid-year benefit elections all year long. We've loaded in a lot of helpful information that we'll kind of go through here shortly. I want to show you guys a live demo of this, so let's just go right into it. Let me put on my password here. Boom. So when you get to this site, the Oberon Fuels site, you are going to, if it's the first time you've been there, it will be, you will set up your password. So just set that up. Remember that. You'll have access to the site all year long. Now, once you get here, if you are new to the company, it's not going to have any of these boxes here. It'll just say start enrollment. For those of you that have been enrolled, you will see what you've been enrolled in right here. All right. So go ahead when you get to the screen, go ahead and hit start enrollment. It's going to give you an idea what to expect. You hit start. Here's where you're going to find this video that you're watching right now. Continue. Here's where you're going to put all your information in. Notice all the stars. You got to do that or else you can't get through. Dependents. If you have dependents, please list them here. If you list them here, it does not mean that they are enrolling. It just means that they are in the system so you can use them to quote. So even if you don't plan on enrolling your spouse and or your kids, please load them in here so you can toggle through the prices, and I'll show you that in just a second. So Medicare, if not, continue. Benefits. So here you're going to find all your benefits. Now, the very first thing you got to do is elect to enroll. So I'm going to elect to enroll for everybody. Okay. Me, my wife, my 3 children. All right. And if I was enrolled before, I had terminated myself because this is a test account and we're messing with it, but it would show your current plan and your current prices. Okay. That way you can compare it to what you're looking at now. So here's all the different plans I have available to me. All of these links will take you to some different document or link. This is going to show you all the plans next to each other. So each benefit plan has that. That's a side-by-side comparison of all medical plans. Here's the benefit summary for this particular plan. All right, so if you just wanted to look at details on that, you'd look there. Summary of benefits and coverages. This is a mandatory document, so all of you are going to be required to open this. This is an Affordable Care Act rule that everybody must open this and review this. So please pardon the extra step there, but that is a government and official rule that we have to comply with. And for those of you that want to watch a video tutorial on how to find a provider, I've recorded a number of those and put those into this system here, so you can find how to find a provider tutorials for all of these. All right. So here you see, I kind of even highlighted this. So for out-of-state employees, by me. So this is another reminder that this PPOE network is a national network, and that's what you want if you're an out-of-state provider, out-of-state employee. Okay. So let's just go with, let's say I want the Sharp plan. No, we'll go with United Healthcare Gold plan. You will not always see all these plans. If you're out of state or you're in Imperial County, you're not going to see some of these plans. Okay. I'm going to choose this plan here. I have to open my summary of benefits and coverages, or else it will kick me back later. So I just did that. You're welcome to download or print this information. Once we've done that, now I can see my per pay period cost for everybody is all that amount. Now what happens if I do this? if I deselect, I don't want to enroll my kids. See what's happening over here on the right? Instantly, I'm seeing the numbers change. Okay. I don't want to enroll my wife either, just me. Now I can see how much everything costs. All right. Now when I waive, I've got to choose a reason. Spouses group plan. You can say Anthem 1, 2, 3, 4, 5, 6, or you can do something like spouses group plan. Boom, 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 boom. Fine. Or even something all the way down here to other because. Okay. This button will also help you compare the plans side by side. So once you've done all that stuff, you're going to skip to the next page. Oh, I'm sorry. There's a primary care provider box down here. So if you choose an HMO plan, a United Healthcare or a Sharp HMO plan, you need to choose your provider. So when we have these tutorials on how to find a provider or a link straight to the site, the United Healthcare site to search for a provider, you'll want to do so and put their information into the PCP ID and name. This is primary care provider. Or you can hit auto assign, and the insurance company will assign a provider nearby. Here we have dental. Again, we've enrolled for some, not for others. So if I left it like this, it would kick me back and say, you need to tell us what's up here. We're going to do no other coverage. Don't want. Okay, got it. We'll enroll this child here. And the price didn't change. You notice with dental and stuff like this, you're not going to see any price changes. So you want to enroll everybody. If you got one kid enrolled, enroll all of them. It's the same price. All right. Here I had the PPO Platinum before for $25 a pay period. And here it is again. So we didn't see any price increases or changes to our dental and vision plans. And we have our benefit summary. We've got a link to the provider page and also a video tutorial that you can watch on how you would search for this. Remember, the Platinum plan uses the Premier network. Vision, we'll just enroll, well, we'll decline everybody here. Or you know what, for sake of speed, we'll just enroll everybody. All right. Now, I didn't enroll everybody before, so my number was a lot lower. Now that I'm enrolling everybody, I have a higher number. Again, the links are here. Continue. It's going to give me the summary. I'm going to go through here and make sure it's all what I want. Yes, it is. Okay, great. Continue. I missed some stuff, so this is where you'll find out your the items that you have missed. So do that. Save. And then sign forms, child tester is missing one thing. Here we go, let's do it. They're sticklers for getting it all done here. Save, moving right along, continue. You can skip all the way down here since you know you're done. Sign forms. Now, if you've used DocuSign, then you are familiar with this technology. You're going to sign 2 different times. Once you're going to type and once you're going to use your mouse to sign. So we're just tester, and then you're going to use your mouse to sign. Boom. Next. And then you're just going to drop your signature and your signature into every single place where they need it. Now you can actually go through and see the actual application. You're welcome to download this, print this, save this, whatever you want, or you can just hit finish signing. Finish signing, and then the last thing, you can tell us about your experience, or hit the finish button right here, and you are all done. Last thing I'll show you is this documents box right here. We have loaded in a whole bunch of really good stuff. The individual benefit summaries, the Cal Perks flyers, COVID resources, mobile app flyer, online provider search. So lots of really good things in this documents tab that are good, useful information to you all year long. So I welcome you to check into that. And then we are wrapping up. And the only thing now is look for your invitation to log in. Will be arriving in your email inbox on Monday, April 5th. Your deadline to enroll is Monday, April 12th. If you have any questions or any needs, I am here to help. Tamara is here to help. Please reach out to us and let us know how we can help you select your benefits, understand your benefits, feel good about your choices. Or if you have questions about healthcare in general, I'm happy to help. So Thank you so much again for your time. If you're still listening all the way to the very bitter end, I'm so proud of you. I'm so thankful. Uh, but thank you so much, and we will talk soon. And I look forward to hearing from you. If you have any questions, take care.